There are certainly many challenges facing the United States multi-trillion-dollar healthcare industry today. One of the most critical of these challenges is streamlining business processes and delivering medical and patient information more effectively. Electronic health records, EHRs, are an important step to improving and simplifying the way we operate our business and deliver patient care, while managing costs. With EHRs, the days of paper chasing are virtually over, allowing clinicians and office staff to work more productively and efficiently.
With electronic health record, everybody has access to the chart at the same time.
When we were on paper records before we got our electronic record, we had rather fat charts, and in fact, our charts were getting to be so fat we had stored charts and actual charts. So you had to go to volume 1 or volume 2 to find what you needed.
Adopting electronic health records allowed me to condense the patient's record into one single location and to pull the data out and involve the patient in their care. But whether we're talking about body mass index and graphing their weight, or an A1C and their level of control, I was able to pull that out and involve the patient in their care at the point of service.
What a huge advantage it is to be able to retrieve patient information immediately and have it accessible to all authorized personnel. It not only increases productivity, but eliminates days of searching and compiling patient data. EHRs can potentially allow for more patient visits in a single day, as well as allowing more attention to be given to the patient at the point of care.
The communication within the practice has vastly improved. The patients arrive and the nurse opens a template which might pull up specific for the age and sex, the type of things that need to be done for that patient. So the tool communicates by having a robust system in which we can both plant messages and actually send messages to each other.
Paper prescriptions have often caused medical errors due to illegible handwriting, and EHR prevents the dangerous consequences of a pharmacist misreading a prescription. The system also has the ability to flag possible patient allergies, drug interactions, or dosing problems, and patients greatly benefit from having their prescriptions ordered and ready even before they leave the provider's office.
Something as simple as a medication refill in the past required a runner to take a note from a nurse, go to the chart room, pull a chart, provide that chart to the doctor or the nurse, approve the refill, phone in the refill, then send the chart back to the file room to be refiled. And that was tremendous effort and expense. Now, there are two ways that we will refill prescriptions outside of the office visit anyway. They can call in on our refill line, leave a message, and then one of our intake people sends that request to me, and I literally, with the click of a button, can approve that refill. And within that data field is going to be their next appointment. The other way that the refill request can come is directly from the pharmacy, and that also presents in the same data field. I can take a look, have all the relevant information, and literally something that was a rather concerted effort can just take a matter of a few seconds.
The electronic health record gives us the opportunity to take a look at a patient's medication record history, but also lets us take a look into their formulary. Previously, in a paper environment, there was absolutely no way I as a physician could understand every formulary for every insurance that I might accept in my practice. In the electronic environment, I'm actually prompted based upon a patient's insurance as to whether or not a medication that I wish to prescribe is on formulary. If I'm thinking of a medication that's not on formulary, the system actually can prompt me about other alternative medicines that actually would be equally efficacious in treating their underlying disease and yet cost the patient much less than would a non-preferred medication. Because it really doesn't do any good if I prescribe the very best medication if the patient can't afford to fill it.
The patient portal is where the immense benefits of an EHR come together for the patient, the provider, and the practice as a whole. Through the Internet portal, patients can access the major components of their medical records. They can request prescription renewals, schedule appointments, view laboratory test results, and communicate with their physician and physician's office staff.
When we first adopted the patient portal, a patient sent an email at 5 o'clock in the morning that said they had a fever and a cough and they were worried that they might have pneumonia. And I came into the office and pulled up the portal and saw the note at 6 o'clock in the morning. I looked at my schedule, I had a 7:15 opening, so I sent him in back. It says come in at 7:15, and I sent a note to the nurse. Patient was coming in. Got here at 7:15, got his chest x-ray. He did have pneumonia. Was able to get him started on antibiotics, and he was home by 8 o'clock. So being able to use that kind of information to get patients directed to the right place for the right care at the right time is only going to be available if you have things like patient portals and information exchange with the patients.
When the physician finishes the visit with the patient, they send a summary to the patient portal, which the patient can go on and view. Also, they can expedite the flow of the practice and the flow of their personal visit by going on and making sure that their personal information is updated before they come to the practice. So it's a bi-directional interface between the provider and the patient that really brings things home, and it's encrypted and safe out there on the internet.
In addition, as far as efficiency of the practice goes, a portal can be utilized for online bill pay and things of that nature to enhance practice efficiencies. The thing I really like about Portal is it's secure. It's username and password protected. The patients can log in without fear of disclosure of that information elsewhere, and they may retrieve portions of their medical record, whether it's a recent test result that we're trying to communicate to them, or simply a message from the physician to the patient.
People were just floored by the ability to go in and see the report and get feedback from their physician just very quickly, not having to wait 2 to 3 weeks to get a CAT scan report or an MRI report back. But as soon as the report was available, we would type a note on it, post it on their portal. If we're going to empower our patients to take control of their own health, we have to give them the information.
With the global movement in full swing towards using information technology to transform the healthcare industry, the time to get on board with an electronic health record is now. Patients want the convenience and involvement with their healthcare services. They're curious about the benefits and safety improvements that electronic health records can provide, and are educating themselves and requesting such technology within their care delivery. To improve patient care, healthcare providers must have easy access to information.
It's really not about picking a piece of software. It's about changing your practice to make use of the functions that that software can provide. And indeed, without the ability to collect and analyze and exchange your information electronically, I don't think it's possible to go much further into the future, because already things have changed so tremendously in the last couple of decades.
The question looms, can you wait a few years before initiating the change to electronic health records? Between the federal incentive program, the reform legislation, and the impending financial penalties under Medicare, the push is strengthening to move your practice to an EHR strategy. For additional information and resources for EHR adoption, visit 10med.org/adopt EHR.